I say this all the time to my residents when I'm teaching them, and I caution them not to jump to the solutions, jump to the treatment plan before they're sure they got the diagnosis right. Hi, I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Thanks for joining me every week, and I would love for you to like, follow, subscribe, and give me that 5-star review to help us spread the word. Today, I want to talk about some recent events. On December 4th, 2024, a United Healthcare CEO, Bryan Thompson, was terribly and unceremoniously murdered on the streets of Manhattan on his way to work. He was outside the Hilton Midtown Hotel, reportedly on his way to an investor meeting, and the alleged killer found him and shot him in the early hours of the morning, right in public eye. I remember when it happened, it was all over the news, and my own reaction was one of horror, repulsion, nausea, and also realization of the deeper layers of meaning and implication of such an event. The alleged killer, we were told on the news, reportedly might have had some personal experience with healthcare, and in particular with denied healthcare, may have had himself healthcare problems like chronic back pain, might have had surgery. We don't know all the details in full confirmation. But we began to hear this narrative begin to play out that someone in the high echelons of the healthcare industry had been targeted by someone who had a vendetta, had pain, felt injustice. Initially, there was a social media posting that the United Healthcare Corporation put up to commemorate and memorialize Bryan and his life and his personal goals and contributions to healthcare, his family. And what played out on social media was actually incredibly shocking, but it was also very revealing. We saw responses that seemed inhuman. There were social media comments that were angry, vindictive, demeaning, mocking him as an individual, saying that he deserved this. And they were sympathetic and supportive toward the killer. You could feel this collective pent-up rage and pain all across the U.S. as people reacted to this event. But I think many of us, especially in healthcare, were really surprised at how rageful it was. A man was murdered in public, a father, a businessman, and it seemed that many Americans spitefully believed he deserved it. Or did they? Written on the bullet casings that were found at the scene of the crime were the words deny, delay, depose, which we began to speculate was in reference to a book that was actually published back in 2019, written by Jay Feinman, who's a legal expert and industry critic, teaches as a law professor at Rutgers University, in which he began to call out what he believed were practices of the health insurance industry that were designed to reduce access to care for patients. And he claimed that health insurance companies had systematic strategies in place to maximize their profits by actually denying or delaying needed care to patients. In the week following his murder, the National Opinion Research Center actually did a poll out of the University of Chicago, interviewing 1,000 Americans to find out what they believed was the root cause, what was really responsible for Bryan Thompson's murder. Thankfully, many, 79%, reported that they believed the individual who committed the killing was responsible for his death. But also, rather disconcertingly, a large percentage, more than 70% of Americans, believed that his death was caused by denials for healthcare from health insurance companies and The same percentage believed that profits made by health insurance companies were responsible for his death. So many Americans were unable to see the killing of a man as separate from what they saw as the injustice in the healthcare sphere. I heard many stories from patients in those first couple of days and weeks after this event, and I related to them. I'd heard them before, and as a physician, I'd experienced the frustration at the what seemed injustice at having care denied or access denied by a health insurance company. These stories are raw, painful, and they're undeniably familiar. Clearly, there appears to be something very wrong in the American healthcare system. To me, as a physician and surgeon, as an owner of a practice of business, and as a patient advocate, I heard and recognized pain. It looked like rage. It looked inhumane, but it was pain. And I heard exasperation, like abject exasperation. I heard desperate helplessness, patients who know what they need, whose doctors know what they need in order to heal, in order to recover, in order to get function back in life, are often unable to get that, at least not in a reasonable amount of time. And they suffer helplessly, feeling like there's no way to overcome in the system that denies them what they want and delays, requiring more and more proof that the treatment their doctor says they need is reasonable. Most importantly, I've heard injustice in this event, and it is rising to the surface and being exposed in a way that we all are becoming aware will change the healthcare sphere, especially in the United States, forever. That is my hope. But we are at this crossroads where what we choose to do with this awareness, with this raw, poignant moment, will determine our future, good or bad. Unfortunately, what I see us doing, and I think that the human nature is to do this, is to initially look for who to blame. And sometimes it feels simple and straightforward to identify the one who is to blame for this injustice. Because once we identify that, we believe that we're going to be able to address that issue. Maybe it's punitive, we think that's needed, and it's going to change. But our instinct is to find who is to blame. Feynman wrote his book about the healthcare industry's practices back in 2010. This has been years since this first began to come to light. But here we are in 2025, 15 years later, and to be quite honest, the practices he described then are still present. Probably even more present. Probably even worse. American health insurance companies have ramped up their use of prior authorizations. This is one of my deep places of sense of injustice in healthcare. And I know that many nurses, doctors, and therapists feel the same as we're trying to provide care. Health insurance companies seem like they might be the ones to blame for what we're experiencing. They've decreased reimbursements to physicians and hospitals. They've increased the cost of premiums to employees, employers, and yet the amount of care that we're getting seems to continue to go down. The American Medical Association has done studies to evaluate what is the impact of this on our system. And they've demonstrated that reimbursement and denial procedures of health insurance companies can be credited with the closures of many rural hospitals within our country because of lack of resources to actually pay for care. It can also be credited with the mass exodus of physicians out of rural communities where reimbursements are so low and the ability to access care is so restricted by health insurance companies that physicians can no longer find their work tenable. We pay more for insurance and we get less. Prior authorizations is an area of health insurance that is unique to the U.S. healthcare system currently. Years ago, this was a practice that just was intended to be applied to new, expensive, high-tech medical interventions. And the idea was to try to ensure that these interventions were actually medically necessary so that the financial burden on the system as a whole would not be excessive because some new trendy treatment is popular, but that in fact, tried and true treatments that were less expensive were appropriately trialed first. And that seemed to be logical, and it seemed to actually make sense from a fiduciary perspective, trying to manage healthcare cost. But now, prior authorizations are being used to deny and delay nearly every treatment we prescribe as providers. We even see prior authorizations being used to allow a patient to obtain generic prescription drugs. The increased cost and time that this has actually put on physicians and practices is growing. The American Medical Association did a physician survey study back in 2023 where they looked at this specifically, and they actually found that 94% of providers reported that prior authorizations regularly delayed needed medical care by weeks, sometimes months. 78% of providers reported that these prior authorizations sometimes led to treatment abandonment because the delay was so significant and the patient's medical need was so acute that they no longer could go down that path. They had to apply a different treatment plan. 93% of physicians perceived that prior authorizations had a negative impact on their patient outcomes. And a percentage of those reported that prior authorizations had led to an adverse patient outcome, where a patient had a bad outcome due to the delay in care. The impact on the business practices of medicine from this is seen in the hours spent by staff trying to fulfill the documentation requirements of prior authorizations. They reported that on average, a practice had to complete 46 prior authorizations per physician per week, and that this actually translated into 12 additional hours of staff work every week just to get their patients the treatment their physicians ordered. A percentage of physicians reported that they never appealed prior authorization denials because they believed that the appeal process was so onerous and had a low likelihood of success. So even though the prior authorizations may actually have been put into denial status in error, due to a documentation error or whatever, and had a chance of actually being passed if appealed, many practices wouldn't even give it that time. They couldn't. We are literally breaking under the weight of this injustice. And I could go on and on. I'm literally only touching the surface. Many of you, my fellow healthcare heroes, you know on a day-to-day basis how this injustice is gnawing away at our system and is the weight that you carry and the burden that you bear every single day. There are so many other areas of injustice. Prior authorizations and claim denials is one. It's huge, but it's only one small one. What about the massive price of pharmaceuticals? Here we are receiving scientific breakthrough, heroes who are discovering new ways to bring people into healing and to cure diseases that we never imagined we could. And yet, how do we get that to the average person when the treatment costs thousands and thousands and thousands of dollars? And can we really justify that? Doesn't that feel like there's some deep level of injustice that the cost would be so burdensome to bring what the breakthrough of our age has designed? What about biomedical devices? Who gets to use them? Who gets to benefit from them when the cost is so astronomical and these companies have massive profit margins? We love our capitalist free society, don't we? Until it means that I am denied the breakthrough and the healing that could be available. Hey, healthcare heroes, have you been impacted by this podcast? I've been working on making this content freely available to all of you through my nonprofit, and I would love for you to be able to help me in this effort. You can make a tax-deductible donation at our website, restorehealthcareproject.org. Thank you for helping me champion hope. Who is to blame? I think that we can make the mistake, just that, like what is so human to do, to blame this nebulous entity who is the bad guy. So it's obvious, right? I've just talked to you extensively about the practices of health insurance companies. And it seems like most U.S. citizens believe that health insurance companies are at least responsible for part of the problem in our U.S. healthcare system. So it's them, right? Or is it the insurance company executives? Maybe it's not everybody. There's probably good people who work in the health insurance companies, right? And they're trying to do the right thing. They're trying to do good work. They go home to their families and feel proud of what they do. But it's maybe the executives. They're the bad guys. Maybe Bryan Thompson really is the bad guy. Maybe he is responsible for the deaths and pain of many, many people across our country. Or is it the legislators? Have the legislators failed us by not creating laws that protect us, that by actually schmoozing with the lobbyists and creating legislation that helps the profit margins of these mega companies and doesn't prioritize the rights of the vulnerable? Or is it the lobbyists? Maybe the lobbyists. Maybe we could call out the lobbyists because what they're doing is so perverse to try to influence legislators to ultimately make a bigger buck for these companies. It's the lobbyists. How can they live with themselves at night? Actually, you know what it is? It's probably the current president. I think we should blame the current president or the incoming president. Somebody has not done the right thing and this injustice continues. Or maybe it's the governor. Maybe it's the governor in your state. They have set up health policies that perpetuate these injustices. Or maybe it's just the American free market society. Maybe we can't apply that in healthcare. Maybe that's actually the villain in the story. I say this all the time to my residents when I'm teaching them, and I caution them not to jump to the solutions, jump to the treatment plan before they got the diagnosis right. It's so important. I encourage them to review their assessment, think about the possibilities of what the diagnosis might be, because if they embrace a diagnosis too quickly and it's wrong, their treatment plan is going to be completely wrong. And the sequela of that decision-making will be poor. I think this applies to us as we face this moment in our country and in our culture, assessing what is wrong in healthcare and who is to blame. I think especially we, as followers of Jesus, need to make sure that we get the diagnosis right. And there is a trap that is so easy to fall into and that we have a pattern for to help us avoid. And if you are not currently part of the healthcare system in the U.S. or living in the U.S., maybe you think this doesn't apply to you, but I assure you, I have been around the world in different healthcare systems, and you will agree with me if you are part of one of these other healthcare systems, they're not perfect either. And in fact, although the villains may look different, the problems stem down to kind of the same thing. We struggle with money and resources in one way or another, and we struggle with allocating them in a way that is just. There is this problem of misidentifying or misdiagnosing your enemy. It's actually quite hard to figure out who to blame. It's easier just to vilify some depersonalized, nameless villain and to demand justice from them. A man died in the prime of his life on the streets of Manhattan, and that is not okay. Was justice served? Are we better now? Have we fixed the U.S. healthcare system? Is that the solution, that we take down executives who are at the top of this system? I think hopefully you know the answer is no. No, this is not the answer, and especially for those of us who follow Jesus, that can't be it. But our human instinct does cry out for justice, and it's the way I believe God designed us. And we, as followers of Christ, in a world where we are ambassadors of heaven, get the opportunity to bring justice solutions that look different than what our culture would bring. But we can fail to understand how to do that if we fail to understand who our true enemy is. And I would point out that the disciples of Jesus did that for most of the time that they were with him until they began to get it after his ascension. Because they actually grew up in a society of zealots and of massive injustice that they experienced from the dominant government and culture of Rome. And like many Jews of their time, they experienced the oppression and injustice and pain and even robbery of the Roman system. And they had come to believe that the Messiah would come to rescue them from that. And they believed the Messiah would be a military hero that would destroy Rome and punish Rome and finally set them free from that oppression. And over, Jesus confounded them with his strategy for change. He told them they didn't understand the ways of the kingdom of God, and that he didn't come to bring a military solution. And ultimately, he told them the problem is not Rome. He told them the problem was not their enemies, but that they didn't pray for their enemies. He told them they would never have real power when they wanted to be the greatest, because real power was only given to the servants of all. The disciples believed for a while, even while they were with him, and he was so patiently teaching and showing them. They believed the problem was Rome. But Jesus came to show them they were missing something. And I believe the thing that he really was trying to show them is the problem is not just in the oppressive systems around us. The problem is actually in all of us. And it's in our self-righteousness, just like the disciples did, that we have this human tendency to blame. And Jesus came to show them, hey, it's not just you've heard that if you commit adultery, you have sinned. It's also if you have thought about it. He was bringing into focus, listen, it's not just the most evil among you that you think are to blame that I have come to bring justice to. You have the problem inside of you too. It's the reason Jesus had to come into this world. That in us, we all have been born with this tendency toward preserving self at the cost of others around us. I think it's actually time for us, especially the healthcare workers within healthcare, to first start and do an assessment within us. Before we point the finger, before we blame, before we rise up and fight the injustice, we need to see where that injustice lives in us, where it has any hold. Because it doesn't actually matter if the number of people who are harmed by the injustice within you is large or small. It's the same problem of humanity that we all have. And I I think we need to face it. Who's the one who puts their interests above all others, denying them the answer to their own needs? Sometimes it's you. Sometimes it's me. Sometimes it's United Healthcare. Who lets greed in and tries to get more because of a belief that somehow you deserve more or more is available and it's probably due to you? Is it just United Healthcare? Or is it sometimes you? And is it sometimes me? The problem isn't just in United Healthcare. It is also not just in the U.S. healthcare industry. The problem is in all of us. And we all seek our own interests by nature. It's what Jesus had to come to fix. Isaiah 53 verse 4 says, "Surely he took up our pain and bore our suffering. Yet we considered him punished by God, stricken by him, and afflicted. But he was pierced for our transgressions. He was crushed for our iniquities. The punishment that brought us peace was on him, and by his wounds we are healed." We all, like sheep, have gone astray. Each of us has turned to our own way, and the Lord has laid on him the iniquity of us all. The injustice that we are experiencing currently in our healthcare industry, it has already been paid for. And we as followers of Jesus get to come and look at this from a very different perspective. What breaks every human system eventually in the world is this self-seeking, sinful nature within us that causes us to seek our own and to go our own way and to choose for our benefit over others. We do hurt each other. Doctors pursue their own interests. Nurses pursue their own interests. Patients pursue their own interests. You know this is true. I have sat with fellow clinicians who have worked themselves up into so much frustration and tizzy because they don't think they're getting paid enough, and they're fighting to get paid more. In the U.S. healthcare system, have you checked in with any other healthcare systems to find out what they're being paid? We are doing good. Why are we fighting so hard to get what we think is due to us in a system that is supposed to serve? But patients, it's not just doctors that are doing that. You also show up and you don't agree to pay the bills that are due. Why? You don't even make an effort because you have some belief that your own interests should come first and that healthcare is due to you without any cost. No, we don't do that. Jesus told the disciples that justice was going to be served by him willingly laying down his life. And that just blew their paradigm. How on earth was that going to cause triumph over all the oppression and injustice of Rome? I need you to know this, both you, the provider, and you, the patient, that all of the injustice that you and your loved ones have suffered from in healthcare, in our sphere, it does matter. It matters. It's real and it matters, and it's extremely harmful to us as a society. But I also want you to know that injustice has already been answered and it has already been paid for by Jesus, and it really is actually the only solution, the only one that will ultimately work. Punitive efforts, tearing down, remaking, will only get us so far until we fix the heart problem within all of us. I'm not saying that there's not things that we can do and must do to heal our healthcare system. I actually believe that many of you have been called and given a destiny by God to be justice warriors, to bring accountability and change that will save lives. And he's called you to do that, and you are doing that, or you're thinking about doing that, and it matters. But I'm saying that we cannot neglect the spiritual root of our brokenness. to have any authority over this injustice, that needs to not have any hold on us inside of us. We need to fix the heart problem in each of us first. We need to repent. That's how you fix it. You receive the work that Jesus has done to forgive the injustice that we perpetrate from our own selfishness. The blame for all of this terrible injustice that we see in healthcare, it's us. We're to blame. All of us are to blame. It's not just United Healthcare. And we must face this. We have embraced and built this together, even if in the smallest ways. And we need to start the change in us. The problem is not Rome. The problem is in us, all of us. I challenge you, ponder, let God point out to you in your own heart, even if it's in the smallest ways, where you can release to Him, where you are upset and angry, where you choose yourself, and let Him heal that. Receive the forgiveness that Jesus already paid for. You don't have to live like that. You don't have to live harming others by your own self-seeking nature. And we will see change and transformation as we follow the example of Christ. The way we overcome oppression and injustice is to lay down our own interests, just like He did. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.